It's an all too often neglected little step in the treatment guidelines of common chronic diseases, lifestyle changes. But it's there for a reason. These guidelines are based on the best available evidence, and the evidence is clear that simple changes to diet and lifestyle not only give us the potential to help prevent these diseases, but can have a profound effect on the progression of chronic disease once it has already taken hold, including the possibility of cure. No drug will ever cure a chronic disease, and that is why lifestyle changes are the first line treatment. This isn't fringe quackery or pseudoscience. It's written into the actual clinical practice guidelines, which favour the revered randomised controlled trial, the systematic reviews RCTs are based on, and other strong forms of evidence, and thus provide a steadfast aid to clinical decision making. So let's take a look at some specific guidelines for various common chronic diseases and their risk factors. These are the European Society of Cardiology, European Society of Hypertension and Clinical Practice Guidelines for the Management of Hypertension, recommending lifestyle advice for all grades of high blood pressure, with the decision to add drugs dependent on the success of these lifestyle changes and the presence of other risk factors and severity of hypertension. Which lifestyle changes do they recommend? Unsurprisingly, it's all the usual stuff. Reduce salt and alcohol, increase fruit and veg, reduce unhealthy animal products, lose weight and exercise, and stop smoking. Next, we have the European Society of Cardiology's guidelines for prevention of cardiovascular disease, including lipid control. Again, lifestyle advice is recommended first line for all cholesterol levels and risk scores, and the advice is all the stuff we're used to seeing. Exercise, don't smoke, and aim for a mostly whole foods, plant-based diet. The American Association of Clinical Endocrinologists recommends lifestyle therapy as the foundation of treatment for both prediabetes and diabetes, as well as for atherosclerotic cardiovascular disease risk factor modification in diabetes and overweight obesity. Lifestyle intervention is universally regarded as the first and most important step in the treatment of non-alcoholic fatty liver diseases, with a particular emphasis placed on weight loss, exercise, and avoidance of sugar-sweetened beverages. Because chronic kidney disease shares common risk factors with cardiovascular disease and diabetes, similar lifestyle measures are recommended for this disease, as seen here in the Canadian Medical Association's guidelines. But poor lifestyle habits play a role in the development and progression of almost all chronic diseases through multiple different mechanisms, so I'll finish with osteoporosis as the last example here, with the British Columbia guidelines recommending lifestyle advice as the foundation of treatment of the disease. We should view the identification of a risk factor or the diagnosis of a disease, especially if in its early stage, as a teachable moment to educate patients on the role poor lifestyle habits have played in the pathogenesis of their health problems, and how healthy lifestyle changes can reverse these health problems. However, some doctors may be discouraged from advising lifestyle changes, even if they are convinced of their efficacy, because of the assumption that their advice will be ignored. But patients do listen to lifestyle advice from their doctors and act on that advice, again highlighting the vital importance of proper education for doctors on diet and lifestyle. Another stumbling block is that the established lifestyle changes and diets may be suboptimal, even if properly implemented. For example, a whole foods plant-based diet has been shown to be superior to the American Diabetes Association's dietary recommendations for patients with type 2 diabetes for glycemic and lipid control. The usual diet prescribed for hypertension, the DASH diet, whilst being a huge step in the right direction and streets ahead of the standard Western diet, still includes animal products despite the knowledge that they are associated with higher blood pressure. And a vegan diet produced significantly less of that all-important inflammation than the American Heart Association's diet in people with coronary heart disease when tested head-to-head. How many heart disease patients are told about Dr. Dean Ornish's landmark studies in which he has reversed heart disease and early-stage prostate cancer with his lifestyle program? Nevertheless, even with all these problems in implementing this vital but often neglected first step in the treatment of chronic disease, people are starting to realise its potential. Dr. Ornish's program is now reimbursable for reversal of coronary artery disease in the US under Medicare, and other insurance companies are reimbursing it for reversal of type 2 diabetes, hypertension, obesity, and high cholesterol, as well as heart disease. There are similar reimbursement policies in place for other lifestyle medicine programs, such as the Pritikin program. Progress is being made. So to summarise, lifestyle changes are in clinical practice guidelines for a reason and should not be skipped over. They are the only interventions capable of reversing a chronic disease, and patients receiving a diagnosis have a right to know the power they have over their health destiny with diet and lifestyle, especially given the power of using a diagnosis as a teachable moment. It is vital that doctors get more education about the potential of lifestyle medicine so they can fully implement this step in practice. Lastly, we need to prescribe the lifestyle changes proven to be the most effective. There is great potential to fight disease with this one little step. We just need to use it. Thanks for watching. If you found this video informative, give us a thumbs up and let me know if you have any questions or comments. That's it for now, guys. Talk to you next time. Slán.